But first to the new laws the Prime Minister has today announced to slow down the transmission of coronavirus. Here's what he said. There is now a self-isolation requirement for 14 days for all international arrivals to Australia, taking effect from midnight tonight. Cruise ships are banned from arriving in Australia for the next 30 days, and then it'll be reviewed to see if it needs to be extended. He's also announced some more social distancing measures. So he suggests everyone should stand 1.5 metres apart from each other and stop shaking hands if you haven't done so already. There's also plans to restrict access to aged care facilities. We know everyone over 70 is in the most vulnerable category. The Prime Minister says this coronavirus break from usual protocol could last for 6 months, and June is expected to be the peak.
We can slow the spread, and we anticipate that will be what our task will be over about the next 6 months.
This press conference today from the Prime Minister is what we have been waiting for. Finally, some tough measures that can give us confidence that all is being done to slow the transmission. A crisis can make a leader, but it can also break a leader. And if it turns out that the Morrison government did not act fast enough to stop the spread of the virus, waiting for bureaucrats to make up their mind on the advice, and as a result we lose our parents and grandparents before their time, we will not forgive this government. Already there have been some pretty obvious missteps. These are the 5 things the Morrison government has already mishandled on this crisis. There was no public health campaign until today. Travel bans and self-isolation, again, were introduced too late, only self-isolation measures today. Not enough testing kits are available. There's been an inconsistency of information, and we have an ill-equipped and underfunded hospital system. I'm going to go through these very quickly. When Scott Morrison announced bushfire recovery funds, he pumped out a Liberal Party ad straight away. Remember this? But coronavirus took hold in China in January. Its first case was December the 1st last year. And only today, when we've already got 250 cases nationwide, has a health campaign kicked in. This is what the government is now finally running.
Viruses spread when you cough and sneeze, and the tiny droplets land on surfaces others might touch. You can help reduce the risk by coughing or sneezing into your arm or a tissue. Bin the tissue. Wash your hands with soap and water. To help stop the spread of viruses, like the flu or coronavirus, good hygiene is essential. That starts with washing your hands thoroughly with soap and water. Whenever you cough, sneeze or blow your nose, prepare food or eat, care for someone sick, touch your face or use the toilet. Remember to cough or sneeze into your arm.
This is a good ad, but we should have had it running a month ago before the virus was spreading within the community. Now to the travel bans. Even though we were among the very first in the entire world to introduce travel bans from China, we did not close off our borders early enough, and we did not quarantine returning Australians from overseas. This is action Morrison only took today. We have still been allowing anyone in from Europe and America with no quarantine, no self-isolation, no checks to see if they have the virus. This is just reckless and irresponsible, and it's risked the lives of those with respiratory illness, asthma, anyone who's immunosuppressed or over the age of 70. Now to, I think, what is the most important issue. Case detection and testing for coronavirus. This is the crucial point where the government is still failing. Here's what the World Health Organization had to say yesterday about why testing the population is the single most important thing you can do, even more important than travel bans.
The experience of China, the Republic of Korea, Singapore and others clearly demonstrates that aggressive testing and contact tracing combined with social distancing measures and community mobilization can prevent infections and save lives.
In Singapore, the test kits are rapid and free, and people who were found to be infected were forced into self-isolation. In Australia, we just don't have enough testing kits. That's why the government is now saying only those who've been overseas or have been in contact with someone who has the virus should be tested. This means that we do not know the real number of Australians who have coronavirus. It is likely to be far higher than the 250 cases we know about. We need more test kits. And look, this crisis took off in January, so there's been 2 months to get this sorted. We need more test kits to identify who has the virus so they know to isolate and not pass it on. Finally, the government has also been inconsistent with its information.
But all of our advice internationally is that the peak infectious period is when you have symptoms. There have been very few cases of people transmitting the virus in the 24 hours beforehand, so all the way through our public health advice in our published series of national guidelines, which is the public health advice that the entire country's been using, where we define a close contact as someone who's been in contact with someone who is symptomatic at any stage or up to 24 hours before. This has been the advice since January.
Okay. That was the Chief Medical Officer, Brendan Murphy, this morning on Insiders, where he said the message had been the entire time that you're only contagious 24 hours before you show symptoms. And obviously, David Spears pressed him on that in the wake of Peter Dutton contracting the disease and the Cabinet not needing to be isolated. But it's actually not true that this was the message the entire time. In January, Brendan Murphy said that you could be infected 48 hours before transmission. Here's a line from his press conference in January. He said, AHPPC, the committee, is aware of very recent cases of novel coronavirus who are, at the time of diagnosis, asymptomatic or minimally asymptomatic. And he said, we're also aware of one fairly convincing case of probable transmission from a pre-symptomatic case to other people 2 days prior to the onset of symptoms. People need to know accurate information about when they could be contagious. This conflicting advice from the most senior medical officer in the country does not help identify when people should isolate. Finally, there's the state of our hospitals, and this is a blight on both the state and federal governments. The biggest worry that the government now has is that there won't be enough beds to treat everyone at the peak of the disease. It's something the Prime Minister spoke about today. The coronavirus crisis has shone a light on just how severely under-resourced our hospitals are. We all know the system is already stretched to capacity, and that's before a pandemic is thrown in. We should have invested more in our health system, more beds, more doctors, more medical equipment. We need our government to be on top of this, ahead of this, so our curve, and you can see it on the screen there, so our curve can be more like Hong Kong and Singapore, rather than having cases explode and a hospital system too overwhelmed to treat our loved ones. When it comes to this coronavirus, this is not a guessing game. We already know what's worked to stem the tide of the outbreak: quarantine, social distancing, and isolation of infected people who've been identified by rigorous testing regimes.